Hey friends, welcome to the YouTube channel HealthQ, the place where our mission is to motivate you to look at the brighter side of your health. I am your host, physiotherapist Meghana, and today's video is about fracture, which are common among kids. Now, fracture is one of the common injuries that's prevalent in kids. The common reason being that kids always are involved in play-based activities, sometimes without recognizing the potential danger that lies around them, and they just tend to fall and damage their bones. Second reason that kids develop more fractures compared to adults because of fall is their bones are much more weaker and are developing compared to adult bone. But the good news is, the recovery of fracture is much better in kids compared to adults. The reason being very strong periosteum. Now, what is periosteum? Periosteum is in dense vascular tissues that surround the bone and helps giving the blood supply to the bone. Secondly, the diaphysis, which is the center of the bone, and metaphysis, which is the lower end of the bone, are still developing. So, if the kid develops fracture, still there are much more chances of better recovery since the growth is still on. Let's now understand basically what are the fracture kinds, or else what kind of fracture that could happen when a child develops it due to fall or any kind of injury. Broadly speaking, the fractures can be classified based on what kind of injury or else what kind of damage that has happened to the bone. So the first kind of fracture is called as greenstick fracture. As the name suggests, a fresh green stick, when it bends, it tends to bend from one side and tear partially on the other side. Similarly, in greenstick fracture, this happens especially in the long bones. The bone tends to bend compared to breaking completely and then breaks partially on the outer side and bends on the inner side. The second kind of fracture that happens is called as torus or else buckle fracture. Again, as the name suggests, the bone buckles completely, and this basically happens at the metaphyseal region. Metaphysis is nothing but the bridge or else the joint where the center part of the bone and the lower end of the bone connects to each other. This is the place where the bone gets displaced instead of bending or breaking, leading to torus or else buckle fracture. The third kind of fracture is bow fracture. Very similar to the greenstick fracture, bow fractures happens in the longer aspect of the bone, where instead of breakage of the bone has bent and with very minimal damage or breakage on the outer aspect. Next type of fracture is hairline fracture. Hairline fracture is an incomplete fracture of bone again, where the bone has partially cracked without being displaced or moving anywhere. This crack does not go all the way throughout the bone, only exists to the certain extent or else to a very small area of the bone. Next kind of fracture is segmental fracture. So segmental fracture is a kind of fracture where the breakage of the bone happens in more than two places in the single bone itself. Next is comminuted fracture. In this kind of fracture, the fracture has happened in more than two places in different bones, and the bone is crushed into small pieces, and sometimes these pieces are moving loosely across the fluid or else across the area. And the last kind of fracture is called as bucket handle fracture, or else also called as corner fracture. Now this is a typical fracture that's seen in the legs or else especially on the thigh bone. Commonly happens following child abuse and is typically characterized by the lower end of the bone is totally displaced or out or else detached from the upper end or else the longer end of the bone. This kind of fracture is mostly bilateral, which means it's present in both the legs together and is seen on X-rays as loose bone margin. There is another way of bone fracture classification, and that is first, closed fracture. As the name suggests, closed fracture, the fracture that has happened where the bone is not displaced or moved out of the skin or else penetrates out the skin, then it is called as a closed kind of fracture. On contrary, open fracture is something where the bone penetrates outside the skin. This also involves injury or else damage to the muscles and skin area. The third kind of fracture is non-displaced fracture. This kind of fracture, the bone although has cracked and broken into small pieces, but is not moved outside of its alignment. It just stays to that aligned place itself. The displaced fracture is something where the bone, after breaking into pieces, more than 2 pieces, is displaced or moved out of the alignment of the bone. So this wasn't common classification or else basic classification of the type of fracture that happens. Now let's see what are the common areas in the body which are more prone to develop fracture, or else these kind of fracture injuries is more common in kids. So the most commonest kind of fracture that's present in the kid is called a supracondylar fracture. Supracondylar fracture is a fracture that happens in and around the elbow region, or else you can, to be more precise, on the upper elbow region. Next area is radial fracture. Now radius is a bone that lies on the forearm region and leads, since kids fall in an extended hand very commonly, this is another kind of common fracture. Midshaft humerus fracture, which means humerus is an arm bone, so fracture that happens in the middle of the humerus bone, that is called as midshaft humerus fracture. Fracture of clavicle, or as the collarbone, is common in kids. Galeazzi fracture, which is also the fracture of the wrist region, and in this particular fracture there is also dislocation of the joint along with fracture, that's called as Galeazzi fracture. Even ankle fractures, femur or else thigh bone fractures, tibia fractures, or else leg shin fracture is common in kids. So why there is this need of understanding or else information about this fracture? Fractures, if you know well, it's very easy for you to have a better discussion with your doctor, and at the same time you will also understand the severity of fracture when a child falls or else injures himself. In upcoming videos I will also tell you how the care needs to be taken from the parental side when a child experiences fracture, and also how the fracture rehabilitation process is. So make sure you stay tuned with me on this Kids Preventive Health video series. I hope you are finding the information on our channel helpful. If yes, make sure to like this video, share this channel with your friends and family member, and don't forget to subscribe to our channel if you haven't subscribed till now, because we come up with health, education and awareness videos every Monday, Wednesday and Friday. We cover topics ranging from neurological disorder, from musculoskeletal or else say joint health related disorders, and also about preventive health of kids. This information is going to be very helpful for you in managing your day-to-day health problems. So make sure you subscribe. See you next time. Bye-bye.